Okay, so the pranayama for low BP, low blood pressure. First, understand what is the cause of low blood pressure, right? So the low blood pressure, high low blood pressure, and high BP, both are dangerous, right? If your blood pressure goes low, goes down, that also causes problem, and if that goes high, that also causes problem. And what is the cause of that? So where there is cause, there is solution, right? Like yesterday or like earlier, I have been telling you that where there is cause, there is solution. Okay. If you will be able to find the cause out, you'll be easily solving that problem. So first is diagnosis, second is treatment, right? So the main cause of low blood pressure, because I'm first telling you the sequence for low blood pressure, that is a cardiovascular system disorder, right? Cardiovascular system disorder. And so any breathing where you have to hold will be harmful for both of the cases, even in low, in high also, holding the breath. So low blood pressure and high blood pressure patients should not hold the breath. Then what do? What should they do? Then first thing is, in low blood pressure, they have to avoid any cooling breathings like Sitkari, Sitli. These two pranayamas are dangerous for low blood pressure. Sitkari is Sitli.
For both of them?
Yeah, both pranayamas are harmful for them.
For both? Low.
No, for low.
Low.
For high, this is treatment. Then what they should do? So they should practice Surya Pranayama. So you note down Surya Pranayama. So what, how should I call you? By which name? Tomoko. T-U-M-O-K-O.
T-O-M-O-K-O.
T-O. T-O-M-O-K-O. Tomoko. Okay. Yes, very good. So her introduction, she has joined 200-hour yoga training course, 200-hour yoga teacher training course. Yeah, so Tomoko is friend of Lee. Lee was our earlier trainee. So she is her friend. South Korea.
South Korea? No, I'm Japanese.
Oh, you're Japanese? Oh, sorry. I was thinking you're also from South Korea.
Because I know little bit Korean. I was going to say not
Germany or Japan?
Japanese.
Japanese.
Japan.
Yes.
Japan, right.
My husband is Korean,
Cool.
so I can speak Korean. So
Korean.
I can communicate with her.
So you're speaking Korean words. Can you understand?
안녕하세요. Yes.
감사합니다. 감사합니다.
Namaste, Raja.
감사합니다. Is thank you.
Yes.
Well, so, and this is Aarti. Yeah, she's doing meditation. And Jyoti, she's doing pranayama course. And then Mr. Raja Gopala Pillai. So his short name is Raj, Mr. Raj. Yes. Sri Raj, in India we call Sri. Sri is like Mr. Sri Raj. Or Mr. Raj. Yeah, slowly we'll read, okay. And his name is Parth. Parth. He's doing 200-hour meditation training course. Meditation training course. And so first I am addressing her, and then we will come to meditation practice and then theory practice, theory class. Okay. So actually yoga has three essential components. Asana means posture. Asana is posture. What you have practiced for 2 hours. There is asana practice. Then there is breathing, pranayama. There are different types of pranayama. And then meditation is your mindfulness, calmness. Actually, If you have to give a single word for meditation, then single word is calmness. So when you say I am practicing meditation, then this is meaning that I am practicing calmness. If you say that I want to learn meditation, that means I want to learn calmness. Right? Like you have joined meditation course. You want to learn meditation. Means you want to learn calmness, how to be calm, how to be peaceful.
Or being in calmness.
Being in calmness. But it is very easy, but it is very tough, difficult, because of our samskara, our habit. Habit. So samskara means habit. But many people misunderstand samskara as only doing puja, getting early morning, taking shower, doing pilgrimage. This is samskara. No. They are small parts of samskara. Samskara means your habit, which you have been feeding for many past lives. So any samskara is not created just by a month or by a year or by some years or by only one lifetime. No. After many lifetimes, you create a samskara. And whatever you have been doing continuously, that creates an imprint on your consciousness, and that becomes samskara. So samskara is the main helping or obstructing force that can help you also, that can obstruct you also. Bad samskara will obstruct you, and good samskara will push you up, will push you forward. Both are driving forces. Bad samskara will take you downward, and good samskara will take you upward. There are a lot of things regarding this. When I start speaking on any object, it takes a long time, but I'm focusing only her question is that what are the pranayamas for low blood pressure, right? So first, low blood pressure people should start with Surya Pranayama, because that will make their bodies warm, hot, and that will melt the blockages, the cholesterol, right? So cholesterol is the main cause of heart issues, right? Cholesterol. And cholesterol is good and bad also, right? Bad cholesterol. And we have to melt the cholesterol. We have to melt the blockages. And what melts? Fire melts, right? It is fire which melts, not the water. Even water, hot water melts, not cold water. So cold is against that. Therefore, you find that people who have low blood pressure or high blood pressure, they die during winter season. Most of them, they die during winter season. Most of the heart attacks come during winter season, because cold is not good for your heart. Yeah.
Surya Pranayama individually can be done.
Yeah, yes, please.
Surya Pranayama individually भी कर सकते हैं.
Of course. This is what is called Surya Pranayama. Surya Pranayama is individual pranayama. When you breathe in and out through right only, that is called Surya Pranayama. Chandra. And Surya. Ajay?
I have a question. I know I'm not taking this course. There are normally low blood pressure.
हाँ,
So
उसके लिए मैं बता रहा हूँ. Surya. So low blood pressure people should start with Surya Pranayama. So Surya Pranayama will create heat inside the body. Heat. Then there is another pranayama to activate Surya Nadi more vigorously, that is Surya Bhedi. So Surya Pranayama and Surya Bhedi Pranayama. Okay. And next Anulom Vilom. So always start with Surya Pranayama, then Surya Bhedi Pranayama, then Anulom Vilom. So Anulom Vilom is multi-purpose pranayama. There is no side effects, and there is applicable in all the cases, physiological or psychological, or emotional or spiritual also. Okay, clear? Surya Bhedi, then Anulom Vilom, and then Kapalbhati set and Bhasrika set. Kapalbhati set and Bhasrika asana. Sequence, you know, I mean sequence. But one thing must be remembered while teaching or practicing Kapalbhati sequence and Bhasrika sequence in low blood pressure is, even in low blood pressure also, you should not do forcefully, gently at all. Otherwise, you will feel, you know, dizziness. Yeah. When you do Kapalbhati, powerful Kapalbhati, that may also cause some uneasiness. Have you realized this? Yes. So although Kapalbhati will generate fire inside you, but you have to practice gently, not forcefully. In gentle. Deep inhale. So like Uttar Pranayama. Okay, Jyoti? Like Uttar Pranayama, but not exactly Uttar Pranayama. Little bit more intensive than Uttar Pranayama, but less than Kapalbhati. Similarly, in Bhasrika also. In Bhasrika also, you have to practice gentle, mild Bhasrika. But the sequence will be the same. But this is necessary to note that the counter pranayama of Kapalbhati or Bhasrika, you don't have to do Sitri or Sitkari. Yes, only Anand.
Like Kapalbhati sequence. What do you mean by Kapalbhati sequence?
Kapalbhati sequence is Kapalbhati. When you practice Kapalbhati, then after that you have to restore the breath. And then Anulom Vilom. And if you are normal, if you don't have low blood pressure, then do Sitkari or Sitli. After breath restoration. Then Anulom Vilom. Then again, this becomes a set or sequence.
Breath restoration in दोनों के बीच में.
After Kapalbhati, you have to restore the breath. And what is breath restoration? Is just let go. Don't force yourself to breathe deeply. Just give freedom to your body. Let the breath restore. And it may take sometimes half minute, sometimes 1 minute, sometimes 2 minutes, 3 minutes. That depends on your physiology. Okay. So, Surya Pranayam, Sarveti Pranayam, Anulom Vilom, then mild Kapalbhati sequence and mild sequence. And then Ujjayi and Pranayama. This is ideal pranayama sequence for low blood pressure. Okay. And next,
High BP, I think it started something.
similarly, well, same like low blood pressure, but some components you will change. So, Chandra Pranayama, Chandravedi Pranayama, Anulom Vilom, and then Sitkari, Sitli, and Anulom Vilom, and then Udar Pranayam. Udar Pranayam and mild Vaks Pranayam. Mild Vaks Pranayam, and then Sitkari, Sitli. You can add Yogi Pranayam also, but in Yogi Pranayam, this is really typical. So if you avoid that, it is better. Because Yogi Pranayam is combination of 3 pranayama, you know, and you have to hold also. So if they will hold, that will cause problem. So it is better to avoid. This is only for pro practitioners. If you have been trained in pranayama, then only you should practice. Otherwise, this sequence. Okay. So avoiding yogic breathing, then do Ujjayi and Brahmi. And if there is hypertension, then we have to avoid Ujjayi also. Only Brahmi. But Brahmi is very calming, very soothing, very calming. So this is very beneficial for high blood pressure, hypertension, heart issues, and stress. Clear? Any other question?
Also, I would like to.
For migraine? Yes. So the main cause of migraine is nervous system. Nervous system problem. Nervous system. And stress is the main cause. Stress of migraine. Stress. Because of stress or anxiety, the muscles become very stiff in shoulders, in this area. This becomes very stiff, and the blood doesn't flow freely into the head area. There is optic nerves, right? So that is blocked. That is blocked, or that is twisted, or that doesn't get adequate blood. Therefore, that starts swelling, and as a result, you feel headache. The same thing is in cervical issue also. In cervical spondylosis, in cervical problems also, people feel headache. When they vomit, then they feel lighter. After vomiting, the toxins go out, then you feel lighter in this, then you are free from headache in cervical also, in migraine and cervical also. Or sometimes if that is not being cured, then you take pill like Brufen or Disprin, this kind of Celadon, this kind of tablets you take. And what do? They simply thin your blood. They thin your blood, then blood starts flowing through that blocked nerves also. When the blood goes there, then you feel lighter. Okay, so the best treatment for cervical or migraine is asana, postures. Use the yoga wheel. We have yoga wheel, right? You have seen that. And you put yoga wheel here in upper back, and you come in fish pose. Fish pose. And ask your patient to come in fish pose and start breathing. And slowly, the more channel will be open, the properly more deeper breathings that person will start taking, then pain will start going. And this is a long-lasting solution. This is a long-lasting solution that tones the nerves, that tones the muscles, that tones the pathways, neural pathways. Then as a result, when that is toned, you are healthy. So if your muscles are flexible, if your muscles are soft, not tight muscles, that is sign of your health. That is sign of your health. If any part of your body, if you feel stiffness, should immediately do something. And what is that something? Is asana. But not only asana, but incorporating breathings.
How long it should be?
In that posture, 5 minutes. So first start with this thing, and then in pranayama, in migraine or headache, first Surya Pranayama, then Chandra Pranayama. If you want, you can note down. In migraine or headache or cervical, in any kind of headache. So you start with that asana, and then first Surya Pranayama, Chandra Pranayama, Surya Bhedi, Chandra Bhedi. If you have time, enough time. If you have only limited time, then you can skip Surya Bhedi and Chandra Bhedi. But if you have adequate time, then you can do Surya Bhedi and Chandra Bhedi. Then Anulom Vilom. And then mild Kapalbhati. Not intensive. Otherwise, that headache may be more aggravated. Mild Kapalbhati. And then Anulom Vilom, breath restoration. Then Anulom Vilom. And then Vaks Pranayama. Vaks Pranayama. And then Ujjayi and Bhramri. So you should ask your patient to practice Bhramri more.
That's how it helps.
Bhramri, yes.
Because I get migraine.
Yeah. This is what I wanted to emphasize, that in this whole signal, Bhramri should be emphasized more. That is very helping. All the pranayamas are mentioned in your book. When I'll give you the book, but it's okay. You can note down now, right? Clear? Any other question? In vertigo. Yeah, in vertigo case also, you can do the same sequence. This one. So this is related to head issues, head related issues. Same sequence.
I don't think so. The person in vertigo will do the fish pose.
Not fish pose. Pranayama.
Yes.
I'm asking about pranayama. not the asana. Rather, that will harm. Yeah. So all the inversion asanas, all the strain will harm. So
The person won't be able to even do it
yeah,
because they feel there is a loss of stability.
yes.
So,
Anything else?
not for now. I'm
Okay. And then the next class, I'll ask you to make a sequence, to make a program for a specific disease. And if I'll find any modification, any changes, I will do that. Okay. हाँ बुक में है, प्राणायाम कोर्स में है, लेकिन जो सीक्वेंस जो मैं बता रहा हूँ ये दैट इज बेस्ड ऑन माय नॉलेज एंड एक्सपीरियंसेस. हालांकि मैं सोच रहा हूँ इसको भी इनकॉर्पोरेट कर दूं उस बुक में. मुझे था
पता है बुक खोल के देखते नहीं है.
हाँ
जो हमने जैसे ही क्लास
नोट कर दे हो ना. बिल्कुल बिल्कुल.
रिकॉल कर देते हैं. बहुत बार बुक एक जगह पे रखी है.
कि book is very thick and you procrastinate or you little bit you have laziness also. We'll go and find and you just note the essential points, salient points.
वक्ष प्राणायाम क्या होता है बोलिए?
Max pranayam chest breathing होता है. Inhale and you expand your lungs. Expand your lungs, expand, and then hold for some seconds and slowly. Okay?
ठीक है. मैंने सेम पोल्यूशन के लिए पूछ रहा हूँ. हमने पोल्यूशन में तो 7 दिन तो गई.
Yeah, no, for pollution, first thing is precaution. Then you should avoid going outside. But you cannot avoid going outside, then use mask. Good quality mask. And keep air purifier inside your house. That will modulate the air. In your living area, in your bedroom, use the air purifier.
पोल्यूशन का तो काउंटर गुरुजी यही है ना कि ऑक्सीजन अपनी बॉडी में ज्यादा लो, तो पोल्यूशन का तो यही है काउंटर.
That is not only counter. Actually, if you are how you increase oxygen, can you tell me?
Yeah, I'm asking you, is there any home remedy? Oxygen
Yes, sure. This is what I am explaining. For pollution, first thing is precaution. Prevention is better than cure, right? So these are the preventive measures. Avoid going outside. If you go outside, use the mask, okay? And never do pranayama outside during pollution. Never. And inside the house, keep air purifier. And this is affordable. It's not so expensive. Okay. And air purifier will modulate the air. And then you can do pranayama inside the house. And when you do pranayama inside the house in pure air, then you can increase the oxygen. Right? And also drink plenty of water, pure water. Because water has hydrogen and oxygen also. H2O. Water has oxygen also. When you drink water, then you supply oxygen also to your body. So these are the basic. And take tulsi, holy basil. You know tulsi, holy basil?
plant.
Tulsi leaves, holy basil. Okay. When you go outside, on the left-hand side, you can see the plants here. So that is very helpful in lungs cleansing, and that will increase the lungs capacity. Then you can inhale more oxygen.
तुलसी के अंदर तो बहुत कुछ है.
And that secretes, tulsi plants also secrete oxygen. Secrete oxygen.
Sorry to interrupt you. ये तुलसी, I have heard that इसको चबा के नहीं खाना चाहिए. Is that right?
ऐसा तो I don't know.
No, ऐसा नहीं.
That we have to just gulp.
No, ऐसा नहीं. Actually, when you chew that, then you produce more juice.
Yes.
When juice goes inside, that is better. Because in India this is very popular. दांत को दांत नहीं होती, दांत के पास दांत नहीं है. They don't have teeth. Stomach, पेट के पास भी दांत नहीं होती. दांत तुम्हारे मुंह में है ना, so utilize these teeth. So crush, make the juice, make the paste of food, and then swallow it. It's healthy.
Water, what about boiling water?
Yeah, you can put inside the water also. Yeah, that will.
tea,
Yeah, water also will suck, but the best is directly. You take directly.
Maybe shoot.
Yeah. Because water has also less capacity, has limitation. It also cannot suck all the energies from lips. But when you take directly, you take everything.
So what do you recommend? 2-3 leaves or 10 leaves? I mean,
At least 5 leaves.
fine, let's say,
Yeah, that's what I was.
At least
1 or 50, that's my.
At least 5
Closer to
leaves.
Tea also with that. Boil.
Yeah, you can add in tea. You can make a kadha. Kadha is a kind of tea. Okay, they can just eat as they are.
The best thing is to chew.
Yeah, but it is very important before eating. You must wash it very clean, with running water, so that there will not be any dust or dust particles over there. So whenever you take anything from the nature, you must cleanse that. You must process that, at least water cleansing. Even the chawal, rice, or anything you take, do that.
during the COVID times, there was one remedy was so popular, like potli banake. There is a clove, camphor, and jeera. Jeera, yeah. No, jeera. No.
Lauchi.
No. Okay, ajwain. So these 3 things, make it a potli, then just breathe, inhale, breathe.
Yeah, that also works. That also cleanses your
Very popular.
respiratory system.